This past year, the NFL has seen numerous hits that would lead to a concussion, but none were far more serious than the hit that James Harrison of the Pittsburgh Steelers delivered to Cleveland Browns quarterback Colt McCoy. McCoy spent the rest of the season on the bench because the medical staff claims that they didn't see the hit and returned him to play. Concussions can play a role in the everyday lives of anyone, whether it be athletic-related, car accident, or something as simple as bumping your head. Concussions are serious injuries that unfortunately cannot be seen by the naked eye and are often overlooked because of that. It is important to be able to recognize these injuries and be able to take the proper steps forward in protecting your children, your patients, and yourselves. As a senior athletic training student, I have come across many concussions over the past 4 years, the majority of them being this past year while working with the Kent State football team. It is important for everyone to know what a concussion truly is, when one should be referred to a doctor or a hospital, and what are some serious medical conditions that can become of an untreated concussion. Over the years, people have had many different ideas of what a concussion truly is. In the past, players and coaches and parents have often looked at it as something that doesn't need to be worried about. They just got their bell rung. But according to the Mayo Clinic, a concussion is a traumatic brain injury that alters the way your brain functions. Causes of a concussion can be, but are not limited to, a direct blow, a jarring or a shearing force such as whiplash, which is usually most common in a car accident, and some symptoms. The most documented symptoms that concussions have are headaches, nausea, vomiting, concentration problems, memory problems, and photophobia, which is a sensitivity to light. There are a few diagnostic tests that we can use to be able to help rule out concussions for people. The first being the impact test, which is a computerized tool where the patient will sit down and take the test, and it will ask them how they're feeling, so what symptoms they're feeling, and then it will ask them some simple memory questions, reaction time questions, and some simple yes or no questions. The other one that anyone can perform is the SAC test, which is known as the Standardized Assessment of Concussion, which is a verbal test that you ask the patient yes or no questions, memory questions such as what's the date, what's the year, do you remember who won the game, questions like that. According to Arnheim's Principles of Athletic Training, those are the two most important tests that one should use to rule out concussions. Now that we know what to look for when trying to decipher if one is concussed or not, it is also important to know when you should refer them to a doctor or a hospital. When referring, you need to look for these things: vomiting or vomiting profusely, seizures, or any other kind of serious medical conditions should be referred to an emergency room right away. You should not let those go untreated. And if you think they just need to see a doctor, that's usually they just have a headache, they're just feeling kind of sick, they haven't vomited or anything. You can usually wait until later that day if possible, or the next morning if you have to. There are various serious medical conditions that an untreated concussion can cause. The two most serious concussions are second impact syndrome and a subdural hematoma. Second impact syndrome occurs when one returns to their activity before a first concussion has healed and they receive another concussion. This can be fatal. This can cause mental retardation, and it only happens in athletes or people 23 years or younger, because until the time you're 23, your brain has not fully matured. So it's very important not to return someone to play too quickly. People can end up in group homes and hospitals because of this. According to the subdural hematoma article, a subdural hematoma is a buildup of blood on the brain's surface. The blood rapidly fills the brain, and surgical intervention is needed immediately. This is the most deadly brain injury, so it is important to really take care of these concussions right away. Do not be deceived. There are many more serious medical conditions that can become of an untreated concussion, but those are the most important. Now that we have discussed the importance of concussions and knowing proper steps in not letting them go unnoticed, it is important to start integrating that knowledge when appropriate. Do you think you'd be able to watch the Harrison McCoy hit now and be able to decipher what was happening to McCoy and see what the medical staff did not? Now that you all know what a concussion is, the medical personnel, the one that should make an appointment with, and the medical conditions that can be caused from a concussion, you are all at an advantage of the normal layperson, and might even one day be able to help in a situation involving a possible concussion. Always remember what symptoms of a concussion are and some simple questions that you can ask. When someone says they got their bell rung, you all now know what the true meaning of getting your bell rung is.